Hello, everyone. Welcome back to another session of A Day with your fertility specialist. Thank you for joining us. Sorry about the delay, but we have something very exciting for you today. And we do appreciate you joining us every time. Every click, every like, every share, it really means a lot to us. And we're really hoping that we're impacting you with some knowledge every time we start these sessions. So today we have an interesting topic, like I say. Every session is interesting. We're talking about understanding your fertility test. That's what test are you going to go through when you want to embark on your fertility journey. And joining us to talk about that is Dr. Jane. Hi, Dr. Jane, welcome.
Thank you, Joanna. It's great to be here again.
Always. So, Dr.
Thank you.
Jane, in case you don't know, you joined us for the first time, is a consultant gynecologist, and she also deals a lot with our clients that are looking into fertility and how to progress from there. So we have a lot of insights coming from Dr. Jane. Dr. Jane, so tell us a little more about these fertility tests. What are they? Why are they done? And let's say I would say who should get their cells tested in their fertility journey.
All right. Fertility tests basically are very important for evaluation of fertility in different categories of clients. There are a whole lot. They encompass blood tests and imaging means like X-rays, scans, and all
Okay.
of that. Yeah. For everyone, well, for those that have challenges with their fertility or trying to conceive and having some delays on one form or the other, they are qualified for a fertility workup
Okay.
because you might not know if you have a fertility challenge unless
Mhm.
you are evaluated using any of the fertility tests. Basically, they assess your hormones, you do scans of for both women and men. Yes,
Interesting.
so male and female should be evaluated. So we have different categories of investigations that can be done
Okay.
and interpreted alongside your clinical findings for that client and appropriate solutions offered
Okay,
for
so
that
let's
person.
let's get into these different categories of testing that could be done. I know you just mentioned hormones. So, what hormones are typically measured in fertility tests for clients?
Okay, we have the hormone test for both males and females.
Okay.
So for the women, we do what we call FSH or follicle stimulating hormone and luteinizing hormones.
Okay.
Those hormones basically are produced from the brain and they respond to the ovaries.
I
So
see.
when there is a depletion or reduction in ovarian function,
Mm-hmm.
they tend to be high. So we assess those hormones.
Okay.
Then you also have some other conditions like polycystic ovaries. So generally, women are assessed because you interpret those hormones with the clinical condition of the client so that
Mm-hmm.
when you have very high values in a young person, you want to know why are these high because sometimes it could mean the ovaries are failing.
Oh,
Yes,
okay.
then for older women, I just simply see it as okay, she's menopausal, so we
Yeah.
expect these
Mm.
values. Same thing for the men. We
Mm-hmm.
also assess what we call prolactin. Prolactin, for some persons, they might have symptoms, breast discharge, but prolactin is assessed because it can affect ovulation.
Okay.
Yes, so and also the woman's menstrual cycle. And
Mm.
when you have irregular period, conception becomes a
Difficult.
challenge
Yeah.
for you. Of course, thyroid hormones too. These are produced from a small gland on the neck, and they can also affect your ability to release eggs, which is ovulation.
Oh wow. I
Yes,
mean,
and your
something in your
menstruation.
neck
Yes.
affects your.
So because yes, the thyroid hormones actually affect your metabolic form. Metabolic just means the activities in the
Hmm.
body and the
Okay.
hormones. So basically you assess those hormones for women. While for women too, we also assess progesterone
Mm-hmm.
on well, they say day 21, but you need to have regular periods for it to have even have a day 21.
Mm-hmm.
But day 21 in the sense, but it can be on a different day for different people depending on your menstrual cycle.
Cycle.
And
Okay.
that tells you if a woman ovulates or not. And we know ovulation is a marker of maybe pregnancy and all of that.
Yeah.
Then for the men, we do the same thing. Testosterone, we assess testosterone, even FSH and LH, that's the luteinizing hormones and follicle
Hmm.
we also assess the same for the men. And
Okay.
of course, the values are interpreted within the context of the presentation of the man.
So how do these tests differ? Like you said FSH and LH in the women, and then there's also the same thing in men. I'm actually quite curious as to how there's different markers in this.
Yes, so these hormones are produced from the brain.
Mm-hmm.
Yes, so men too produce those hormones, and once you see high values in them, you can tell that you are beginning to have what we are having testicular failure,
Oh,
interpreting it alongside the clinical presentation
I
of the man.
see. I see. Okay.
Yes, so you can have that. Even prolactin can be assessed for men. Yes, while we have breast discharge, some men too can have some brain tumors that secrete prolactin can be
Okay.
very high,
Mm-hmm.
and that can also be a mark. It can affect the man just like it affects the
The
woman too.
woman.
So we assess that. Of course, testosterone too for the men as men age. The quantity, their quality, their hormones to decline. For same
Mm.
thing for the women,
Mm-hmm.
so you can assess all of those hormones and some other not so common hormones like sex hormone binding globulin and all of that. They
Well, I don't know if you heard, like
they're
my
not so
brain just
common.
glossed over it right now. But there's some lifestyle changes, would I say habits actually, not changes that affect hormones and what the test results might look like.
Yes, a whole lot of lifestyle factors can actually impact your hormones.
Mm-hmm.
Majorly like stressors. Stress is basically you are doing so much.
Yeah.
Stress alone can affect your hormones.
Oh,
Yes. Then also alcohol, cigarette smoking. This has a way of impacting your hormones, your
mm-hmm.
production, and all of that. So basically, those are things. Then weight. When you are now a lot of these adipose tissues or the fat cells, when obese people, they tend to have also a lot of hormonal imbalance. Typically, you see in clients with polycystic ovarian syndrome, they
Yeah.
tend to be on the big side. Yes, we have a few women who are on the slim side but still have polycystic ovaries, but weight gain is also obesity as the word as that's the right word can also impact your hormones
Mm-hmm.
significantly. Yeah.
Okay.
So it means that for you to manage those conditions, you advise on weight loss
Yes.
and, of course, diets, basically.
All right. Well, I know we also have things like scans that are being done for assessing fertility, and before you go ahead with that. So, what are some types of scans that are done during a fertility testing or assessment?
Well, a whole lot of scans, can be different types. Yes. So in the introduction, we mentioned that you can do blood works and
Yes.
imaging.
Imaging.
So the
Yeah.
ultrasound scans fall under the imaging techniques that you
Okay.
use to assess fertility rather. So we can do for the women, we can do what we call the transvaginal scan,
Mm-hmm.
which is you use a tiny probe just through the vagina for clearer view of the woman's reproductive system,
Okay.
the uterus.
Okay.
You can also see the ovaries and all of that. So now on the uterus, it can help you see the follicles, the ovaries. You can
Hmm.
count because as much as you can do blood work, sorry, I forgot to mention anti-Mullerian hormone.
Okay.
It also tells you about your ovarian reserve.
Okay.
Yes, you can use ultrasound scan to also assess the ovarian reserve for women,
Interesting.
which we call the antral follicular count. So
Mm-hmm.
you can count the antral follicles on ultrasound. And of course, it's better on transvaginal scans. Yes, you can do transabdominal scans. Yes, that can also be done. But again, if you have people with a lot of fats, it might blur your images and all of
Okay.
that.
Mm-hmm.
Then for the men, you can do testicular scans or scrotal ultrasound scans.
Mm-hmm.
Yes, you can pick a whole lot that can affect semen quality and even to the point of no sperm cells
Oh
at all.
wow. Okay.
So those are
It's
important
interesting.
images you
Yeah.
can do for the men. Of course, for the women too, we also have if we're talking about imaging technology and techniques under the ultrasound scan, there's this type of scan we call um, lysis saline infusion sonography. What
Hmm.
they do is just like you take water, you push that into or any fluid into the, not any fluid, normal saline, but it's like
Yeah.
water. Yes. So you if instill that into the uterus. So that gives you under a 3D imaging, you can see the uterus just like we see it on hysteroscopy
Okay.
sometimes. So you can easily pick things like polyps. So those are some kind of abnormal growths in the uterus. You can pick fibroids. You can also diagnose adhesions, that scars within the uterus. So that's another thing we can do. And of course, we can do what we call hysterosalpingography as an imaging technique that can help you line the tubes.
So that's HSG, right?
Yes,
Okay.
and that can pick uterine abnormalities. So you have people that have dimpled uterus, what we call septate uterus. You have people that have uterus with just one fallopian tube. Some of those things can actually be easily picked on ultrasound scans, and all those things can impact on your fertility.
Okay.
Then we can do laparoscopy. Those are imaging things. Yes, those, even though they are theater-based procedures, but you can do that. You use a camera to look into the belly of the woman.
Okay. So we're
You
going
can
from
see
scans to cameras now.
adhesions. Yes, those are images still. You can
Yes.
see adhesions like for endometriosis. You can assess if there are scars from infections like pelvic inflammatory disease. You can assess the pelvis and see how caked, if the organs are matted together, what we call your frozen pelvis. All of these conditions have a way of impacting your fertility.
Cool.
Yeah.
That's actually quite an array of things. I mean,
Yeah,
it
so a
just
whole
kept
lot of
going on.
investigations.
So, how accurate would you say these scans and imaging techniques are? Are there any limitations to it? How exactly would you say those impact?
Well, ultrasound scans are very safe and well, they are very accurate. They are accurate most of the time when you're picking well, for pregnancies, you want to look at blood flow and all. Yes, they're also accurate now, but the accuracy now is dependent on the operator,
Okay.
his skills,
Okay.
his techniques, and sometimes some ultrasound scan machines produce better images, so interpretations differ. So that accuracy, I will not say ultrasound scan. So you see, when you have a good ultrasound scan machine in an expert and an experienced person with very good skills, you see that your images and your reports are a lot better
Yeah.
compared to someone with less skills and all of that. So when you talk of accuracy now, of course, technique and the technology
Okay.
has to come in
That's
place.
fair. That's fair. That's quite a diplomatic answer, but we'll take it. So on here we have questions about semen analysis, right? I know you said yes, those fertility tests are not only for the women, and you've spoken quite a lot about the women's side, the hormones that are checked, and how they affect fertility. So, what do we usually look for in a semen analysis? What exactly are you trying to find when you analyze semen sample?
Well, semen samples basically we assess up to about 5 parameters or
Okay.
even more, but commonly we look at the volume, we look at the movement. That's now the movement we are talking about the sperm cells.
Okay.
We look at the counts, the appearance, and even the count per ejaculate. Then sometimes you see post cells and all. Importantly, the very important things you can see. You want to Those are the markers of fertility.
Okay.
You look at movement. You need at least 25% to have rapid forward movement.
Okay.
Then you need a count of over 15 million, 20 million and above using the recent diagnostic criteria by the World
To
Health
count.
Organization. Yes, about 20 million per meal, not
Oh, that
per
that is a
meal.
lot. That
Yes,
is a lot.
20 million per meal. Then for morphology, you need the morphology just talks about appearance of
Okay.
these sperm cells.
Okay.
So you need to see a healthy sperm, normal head shape, the body, the tail, everything has to align. So when you see all of those, you can put them in a percentage and also report that. Yes, there are different um percentages used to report what is normal. But currently, the World Health Organization says 4%. But now, if you use that 4%, yes, sometimes we use 30% here.
Okay.
Yes,
It's
but
quite
when you
different.
say 4%, Now, if I say 4% of normal forms, it means that if I have a sperm count of 3 million, you are saying that it's just 4% of the 3 million that is good. So you
Mm,
see that the fertility of that person naturally
already quite
is
reduced.
yes.
Yes.
So that's what it means.
Oh, okay. So, but are there like lifestyle changes, or I keep saying lifestyle changes, lifestyle habits that would affect the quality, or should I say the quantity, those parameters that you look for in a semen analysis? I know I've heard a lot of things like people saying, "Oh, don't drink too much sugar, don't put your laptop on your crotch area," things like that. What kind of lifestyle habits would affect the outcome of a semen analysis?
Yes, a whole lot would affect lifestyle, but commonly, first thing we mention is well, alcohol,
Mm-hmm.
cigarette smoking. This one they can affect number. That's the count.
Yeah.
They can affect appearance, production, and all. Yes, when you talk about basically, then of course, weight gain, excess weight gain,
Okay.
obese people, yes, you can have poor sperm quality. Then,
Mm,
yes, when you talk about laptops and all of that, is heat. Yes, heat, even from hot bathtubs and all of that, they have a
okay.
way of
Okay.
affecting the quality of the sperm. Yes, sometimes people talk about wearing tight underwear.
Mm,
Yes,
yeah, I've
the
heard that
major,
too.
the problem there is the heat,
Mm,
not the tight underwear. So, of course, it's assumed that when you wear tight things, you have a lot of heat.
yeah,
Yes, so, but someone that is wearing a spandex, maybe a nylon, and someone that's wearing cotton, they
cotton
are
is
not in the
different.
same
Hmm.
category. So you might not really, so the tight things might not really fit into that category. But the impact on the sperm quality is the laptops and the hot bathtubs. They have more impact than the tight things we hear about.
Fair enough. Well, that's more understandable because I feel somebody might think when you say tight things, it's just that constriction, it will kill, the sperms there. I think that's a myth that surrounds that. Do you know of any other myths that you'd like to address around this whole the male factor side? Let me say.
Well, some myths that we have about the men and probably the semen and all of that.
Mm,
You see, a lot of times people say that men's fertility, they are not affected in any way. But the truth is, as women's fertility, generally with age,
yeah.
there's this gradual progressive decline in fertility for both men and women.
Okay.
Yes, it's more for women time from 35
Mm.
and peaks around 37. While for the men above 40, 45,
Oh
the
wow.
sperm quality begins to drop. So, yeah, so even though older men can father children,
Hmm.
but we know that the sperm quality starts to drop from that point. Then they say normal, when you have normal sperms, normal, like an interpretation of a normal sperm semen analysis
Okay.
is equivalent to good fertility. That's not always the case
Oh, okay.
because we also have an investigation now. Well, what we currently do, we call it fragmentation of you look at the genetic material of those sperm cells you can
Wow.
see, call
Wow.
it DNA fragmentation. I
Hmm.
actually do those tests here.
Mm-hmm.
And so that in that your normal sperms, you might just have a pool of plenty of sperms, but their genetic
Fragmented.
materials will be significantly not up to par with
Hmm.
what can cause
Okay,
pregnancy.
so call it a quantity is not always quality, or should I say
Yes,
superior quantity doesn't always guarantee
yes,
quality.
yes.
Okay, that's interesting.
Basically, those are common myths. Then the hot things, when they say
Yes.
hot, tight clothes and all of that,
Mm.
is the heat that matters the most. Not,
Okay.
and when you talk about some kind of occupation you do, someone sits on the engine for a very long time and all of
Mm.
that. All of those things have. Those are some of the myths. People just think about the tight things. No, it's the heat you generate around the area that
Okay.
affects sperm production.
Well, that's interesting. I hope that cleared up some misconceptions for you. If you've thought about this or you've been told to do something related to this and you're just wondering why isn't anything changing, it's probably because there was a misconception or a miscommunication of this advice that you had gotten. So yes, when these tests are run, I'm sure there's a range or there's let's say a healthy range that you're looking for. So when things are out of range, how exactly would you advise your clients to go about their next steps
Well, when you say things are out of range, can be above
or
and
below?
below.
Yes.
Yes. So, and I had said that we interpret results based on your clinical condition
Mm-hmm.
or the history, your clinical history, so that So for some, a high value might just mean this.
Mm-hmm.
And so when a client has presented to you, you've taken your history, you have examined her. When you take your hormone, your test, there are things you expect.
Okay.
So when those results come out, you now say, okay, with this and this and this, we think you have this. You counsel them on the results and the next step. So if your diagnosis is okay, from this hormone profile, we think you have polycystic ovaries from even your scan and all of that. Yes, you might not ovulate regularly like others. Pregnancy might be delayed at some point. What
Yes.
can we do? Can we induce ovulation? Can we drill the ovaries? We can do this, we can do this, we can do that. So you outline your care that you can offer them, and that takes them up from there, because a lot of people are just floating with a
Yes.
problem because they don't know the next step.
Exactly.
So I do HSG for a woman, and we say the tubes are blocked. And we know that blocked tubes, the chances of spontaneous conception is almost zero,
Mm-hmm.
except that diagnosis of blocked tube is not accurate.
Okay.
Yeah, so you just tell it from that point, you start advising them on other options that can skip the tubes, which
Hmm.
is commonly IVF.
Okay.
Yes, so you counsel them in line with the diagnosis on that evaluation you have done. So, be it blood work, imaging, semen analysis,
Mm-hmm.
all of them, you can counsel them for treatment per time for what the diagnosis is.
I mean, you already touched into a little bit of the next question I would want to ask you. But are there things that can improve fertility if the results indicate otherwise? You know, that fertility is a bit on the lower side or the chances are a bit lower. Are there things that could be done based on the different categories of tests that are carried out?
Well, it's treatment, your treatment will be guided by your findings.
Yes.
So I have you do semen analysis for a man. He has severe, maybe you don't have sperm cells at all,
Mm-hmm.
and you ask him to do a scrotal ultrasound scan where you look at the testicle size and other abnormalities, and you find out that he has these abnormal veins surrounding them, which we call varicocele. So
Okay.
he can have a procedure that takes out those abnormal enlarged veins
Hmm.
because they produce some form of heat that affect the sperm
Now
cells.
this heat, man.
And when they are taken off,
Mm-hmm.
and after a while, those people, for those kind of men, their sperm quality improves.
Okay.
Yes, so now it's the count that now determines if you can go on to have spontaneous pregnancy,
Mm-hmm.
or at least you have sperm cells for other forms of treatment you'll be offered. Same thing for the woman. If we check who can do your ultrasound scans, or your like the saline infusion sonography,
Yes.
and we see polyps, and we see any abnormality, even at hysteroscopies that we do,
Mm-hmm.
you can actually take off. If you find scars, you can take them off
Okay.
using a scissors
Okay.
or a laser, which
Mm-hmm.
you can offer all of them. Then you can also take out those polyps if you find them there.
Mm-hmm.
You can also, if you find large fibroids on ultrasound scan affecting the lining of the womb, the woman can go ahead to have fibroid surgeries. So treatment will be offered according to the woman's presentation and what is found. And so for every condition, yes, you might not have the perfect, like, will I say, if I say you have a blocked tube, yes, we have something to unblock your tube. No, but we can always
There'll
have
be other
something,
solutions.
yes, to
Yes.
make you get pregnant and have your own children.
So basically, it's not a final thing when you just, it's just an indication that guides you on how to,
Perfect.
continue treatments for this person. So yes, you might, I know I've seen a couple times, this one is something not related to fertility, but someone will come to a hospital and just say, oh, I want to check for malaria. And you go straight to the lab and maybe they see that malaria is positive, one plus, or I don't know. And then they say, okay, they'll just start treating for malaria. I think it's better to have a guide, your fertility specialist with you, because that interpretation, regardless of how simple it is you think or what you've heard outside, a specialist would give you more of a personalized guide on how to go about treatment and how to improve your chances, right?
Yes,
Yeah, I
you
think so.
just need a fertility expert. Like
Yeah.
I give, for instance, I have someone who has blocked tubes, for instance,
Mm-hmm.
and she's bothered about ovulation. I know that you need to ovulate, but again, even when you ovulate, what are we going to do from that point?
Exactly.
Because pregnancy cannot happen
Mm-hmm.
with your blocked tubes.
Mm-hmm.
So you see, you need that guide to start thinking of other options
Yeah.
instead of waiting for treating other things that might not impact or help your fertility.
Yes.
So definitely you always need a guide to help you put through your fertility challenges. For every fertility problem, yes, there's one solution or the other for them. Yes, some might be very difficult, but there have been successes for even the most difficult of
Yeah.
cases. So why not
Okay.
trust your fertility
Yeah, that's
experts?
true. So I always say this, your first step in your fertility journey is actually going ahead to see that specialist or the fertility expert that will guide you in this. So do you have any advice for people that are, wanting to start their fertility journey? What do you think you can tell them to encourage them to make that first step that we're talking about?
Well, my advice to them is just take the step,
Mm-hmm.
start your process, get your consultations, get evaluated, but most importantly, be ready for it. Work
Yes.
together as a team with your partner. There should not be blame game.
Mm-hmm.
Guard your mental health. When the results
Important.
don't come out as much as good as you want them, work together. Don't allow the stress to stress you.
Stress
Yes.
is stress.
Yes, and you'll be fine. So you can walk through this journey as a team. For every point in time you're walking through this journey, it should be we, not I.
Mm-hmm.
So don't be in a hurry to look out for a problem for the other partner when they find one for you.
Yeah.
Sometimes people are excited when they say this is that and all of
Mm-hmm.
that. But I think you can walk this journey together, but you guide some things you read, limit the amount of information like Dr. Google, so you are in a safe space. Yes, then
Mm-hmm.
also your mental health. Don't listen. It's okay not to even attend some events that might make you feel emotionally down,
Yeah.
baby showers, naming ceremonies. If you don't feel like, yes, those are things that can actually destabilize. I see a lot of women, once you just pass the postnatal ward, you just start weeping and all of
True.
that.
Yeah.
So anything that stresses you mentally, you might just get rid of them. But you can start this journey. Sometimes the journey, some persons wait takes so long, and they start this journey, voila, 6 months, pregnancy on, and we are moving on to antenatal
Yeah.
classes.
There's that.
Yes,
Yes.
so
So,
basically that's just it. Just start the journey. We're always here to guide you through, and most times we make it an easy ride for both for the couple.
okay. Well, thank you so much, Dr. Jane.
You're welcome.
Thank you for expanding our knowledge on this topic. It's quite an important one. It's the first step and really guides how the rest of the fertility treatment or journey might go. Thank you for joining us. If you were interested in this topic or you know someone that was interested in this topic, I hope you share that with them. And yes, this isn't the last time you're going to see this. You can go on our other social media pages, Instagram, Facebook, YouTube, just to refresh your mind on these things. And then you know that you're not alone. We're always here for you. And as Dr. Jean said, you're a team. Whoever it is you're stepping on this fertility journey with, you're a team, and teamwork makes the dream work. So thank you so much for joining us. We appreciate you here every time. We look forward to seeing you next time. We're live Wednesdays and Fridays by 3 p.m. on Facebook and YouTube. I hope you learned a lot and I can't wait to see you. Goodbye. Have a lovely day.